Association of Resident Doctors have urged the federal government to review its demands and convene a roundtable discussions to avert a prolonged industrial action. The appeal was made on Tuesday in Asaba during Quest Television's breakfast program Quest Today on the segment titled The Big Story. Speaking on behalf of the doctors, the president of the Association of Resident Doctor FMC Asaba, Dr. Oji Ifani, stated that the association remains open to dialogue provided the government is willing to engage meaningful and address the 19-point demand that led to the ongoing strike. Highlighting the issues that triggered the industrial action, Dr. Oji identified the government's failure to prioritize the welfare of medical practitioners, which categorized into financial and policy-related concerns. He lamented situations where doctors are unjustly dismissed for personal reasons, while others are compelled to work extra hours, unlike in other countries where medical personnel enjoy better working conditions and shorter hours.
What prompted the strike is because of government's inability to actually cater for the welfare of doctors, and I will basically classify them into financial and policy issues. As for the financial issues, we have a lot of arrears that government is yet to pay, some of them spanning since 2021, and we've been on this issue with the government and they have refused to pay. Then on the policy issues, recently 5 doctors were sacked in FTH Lokoja, and we're asking that these doctors should be reinstated, knowing fully well that we have a lot of brain drain. And part of the reasons we're actually on this strike is because an average doctor does a total of 300 and something hours of call in a month. In SENA countries, 1 unit of call is 1 hour. However, in Nigeria, 1 unit of call is 8 hours. And you're expected to do 40 units of call in a month. So you can do the math. So we are asking that, first of all, these doctors should be reinstated, because in the same institution, we have people, about 2 of them, doing call non-stop for 1 month, and the MD still felt that it was right to sack 5 doctors. So imagine maybe those doctors that were doing call for straight 1 month, by the sacking of those doctors, they might continue to do call for the straight 2 months.
Highlighted the issues that triggered the industrial action, Dr. Oji identified the government's failure to prioritize the welfare of medical practitioners, which he categorized into financial and policy-related concerns. He stressed on the countries where medical personnel enjoy working conditions and shorter hours. He appealed for the employment of doctors as full-time staff with remuneration commensurate to their workload, while advocating for younger doctors to be placed on a fair and structured salary scheme.
We want doctors to be employed as doctors and placed on a salary scheme that is commensurate to their employment, not casualizing them, giving them an appointment that you can wake up the next day and dismiss them. And it also goes to our younger doctors, the house officers. They should be placed on a known commerce salary scheme. And the recent downgrading of the entry level of doctors from Commerce 3 to Commerce 2 should be immediately reversed. It should be immediately reversed. We cannot be talking about the welfare of doctors and the government at the same time is downgrading the salary entry points for doctors. Also, the issue of the IP centralization. Before now, once someone passes his or her exams to be promoted in our medical field, he naturally is promoted or upgraded in IP's platform. However, recently, what it means, decentralization means that it's going to take a minimum of 1 year for them to be upgraded. This is somebody that has paid, that has gone for exams, and all of that. So it is inhuman for government to bring these policies that are actually anti-doctor. And there are many other things that we're asking them to do. One-on-one replacement, for instance. They should be able to replace any doctor that leaves. Then the downgrading of our West African certificate is not just inhuman, it's insulting. That a similar exam that another person from another West African country writes, his certificate is higher than our own. And a lot of time, 90% of those that write these West African exams are Nigerians. So are you now saying that we make the bulk of those that write these exams and you had the mind to downgrade our certificate? It should be immediately reversed.
He further urged patients to remain patient and understanding, emphasizing that the purpose of the strike is ultimately to ensure that doctors can provide better and more attentive care to their patients.
To the patients now, I want you to see this as a win-win for you because the doctors are for you. When we demand that doctors should work less hours, what it means is that we want to have more time for the patients. When we talk about infrastructure in the hospital, what we are talking about is that the patient should have all that it takes to access the healthcare in Nigeria. And when we talk about remuneration, a hungry doctor is an angry doctor. So we want to treat you and we want to see you on the basis of the best obtainable practice in the world.